And those are things I can't answer, as a physician. And so we have social workers and chaplains and therapy dogs. And, we have a whole host of different things as part of our team.
Welcome to Better Together podcast, produced and directed by our Hospice of South Central Indiana, a not-for-profit organization dedicated to making every moment count. We will share true stories about hospice, palliative, and personal care services that we provide in 22 counties all over South Central Indiana. I'm your host and president, Steph Kane. Welcome back to Better Together podcast. So today we have a special guest, our medical director, Dr. Leigh Anderson. So happy to have you. We're talking today about pain and symptom management in hospice care. Dr. Anderson, how does your team approach pain and symptom management in a proactive way?
So, hospice patients, when they come on service, we know that they're going to have symptoms, pain, shortness of breath, anxiety. And like you said, being proactive is kind of the most important part of what we do. I think some big ways that we address it, first and foremost, we bring the healthcare team to you. You're going to be seen by someone at least once a week. Most of our patients are seen much more frequently than that. Mm-hmm. So if something is developing, we can catch it right away. We can nip it in the bud. We can make a pain medicine adjustment or adjust, the layout of the home or, whatever it is. Mm. So that's a big part of it.
Can I ask, what are some of the most frequent symptoms that you see?
Mm-hmm. We see most commonly pain. Mm-hmm. We see shortness of breath or dyspnea. We see, and then the third biggest one would be like restlessness or agitation for like demented patients or confused patients. Mm-hmm. How we also try to help proactively address that is we have something called a comfort kit. So when you're admitted to hospice, you will get a box of medicines, delivered to you. You keep it in your fridge because it's a safe place to keep it. You know where it is. It stays, locked shut, taped closed until you need it. And when you need it, so that it's, when it's 2:00 in the morning, you call a nurse, hey, things aren't going well. I need some help. My loved one is walking around the house and they're going to fall or, whatever. A nurse comes to you. You don't have to worry about trying to get a medicine at Walgreens at 2:00 in the morning. You already have it in the house.
A majority of our patients are in their home or a facility where they live. So those meds are readily available for the caregivers.
Yep, absolutely. So it's great to have those especially for those home patients. We've got the big symptoms pretty much covered in that comfort kit. And then we also do, any kind of medical equipment, so things like shortness of breath, for example. It can be hard to get up and go to the bathroom.
Right.
So we can deliver bedside commodes. We can have urinals. So if it's a symptom that's going to develop because you're trying to do a lot around the house, we can make things easier for you. Hospital bed, maybe that'll help with the pain because you can kind of sit up a little bit. And
what happens if I'm taking care of my dad and I try the comfort kit, I make the phone call, and I'm just worried that the breathing isn't better. It looks like he's still struggling. What do I do?
So always, instead of 911 when you're in hospice, your new 911 is the hospice number. So you always call a hospice number. They'll give direction on the phone and they'll send, a nurse out. They absolutely can send a nurse out to the home. They'll help you, they'll help you with the comfort kit. They'll help you administer the comfort. You're not going to be trying to figure that out at 2:00 in the morning. There'll be a nurse with you. But if, things are really struggling too, we also have the safety net of our hospice house, our IPF inpatient facility. And so we'll arrange for transportation and ambulance if needed, to bring you here to the hospice house. And then you'll be seen by a nurse practitioner, a physician, and we'll get those symptoms under control.
And then you can go back home if that's your
goal.
What matters most. Yeah. Good stuff. Okay. I am going to shift a bit. People worry about taking medicines away, discharging certain medicines when they come on hospice. You've been taking it for years. How do you handle that?
Yeah, this is a great question, and it comes up all the time. What do you mean? I've been taking this blood pressure pill for 15 years. I of course need this. So there's different groups of medications, and there's all reasons why, when patients have a prognosis of months, we're in a different place than you were 10 years ago or 5 years ago or even last year. Patients tend to be more tenuous, a little more fragile, and medications that were helpful now maybe have some more side effects or the risks are greater. So examples would be like that blood pressure pill I was talking about. if you're not eating and drinking, if you're losing weight, as your disease progresses, your blood pressures might be softer, might be lower than what they were before. And if you continue to take your blood pressure pill, you're going to stand up, you're going to pass out, you're going to, hit your head. Insulin is another example. Again, diabetics take insulin for years and years. As appetite declines, or as you might not need it. The other thing too, and I'm more worried about blood sugars being too low than running a little bit higher.
Right.
A blood sugar running a little bit higher for years and years and years has major long-term consequences. Increases your risk of heart attacks and stroke. When you have 6 months or so of life left, if it runs a little bit higher, you're not going to have any negative side effects from that. I mean, if you're symptomatic, we want it lower, that kind of thing. And then other medications too. If patients are falling more, we need to think a little bit harder about blood thinners, anticoagulation. That's always a discussion, between us and the family and us and the patient. And then there's other medicines too. People can take a lot of pills. By the time you get to your 70s, 80s, and 90s, it's almost a meal, the amount of pills people can be taking. So it can interact with each other and can cause upset stomach and
to simple.
So just, we call it reducing a pill burden. So that multivitamin, we can take that away. Is it really making you feel better? Is it really making you live longer, live better? Generally, no. So we'll kind of cut back on medicines that aren't improving quality of life.
Can I shift to the question that opioids can be scary, and that's one thing that may be a symptom management tool. How can we think about those differently?
Great question. And people are scared of opioids, and that is very real, and it's founded, in truth. I mean, the United States had a humongous opioid epidemic, still has one. People die they overdose from fentanyl, from heroin, and a lot of that can be tied back to, people were too free with oxycodone prescriptions or, whatever it was, years and years ago. So things have really tightened up, and people are aware of the risks and dangers that come with opioids. And that is very true. They're very serious drugs, and we take them very, very seriously in hospice. How I think about them is I think about opioids kind of on a spectrum. And so a big phrase that we use as providers is, start low, go slow. And so if you are, we start with the lowest dose. As doses increase, or as if, you start out with no benefit, you might be on an opioid, you might not feel anything, okay, that's too low of a dose. Okay, we can inch it up. Now we get into an area of pain relief or shortness of breath relief. If it's brought up too fast, you get into what we call sedation, where people are a little bit sleepy with it. And if you go way too far, and these would be like the fentanyl overdoses, you don't know what you're getting on the street, et cetera, then you get respiratory depression, where your breathing really slows down, and then you pass because you've taken too much. The beautiful thing about, again, hospice is those frequent visits. You have nurses, you have nurse practitioners, you have providers who are checking in on you weekly. I mean, the nurses are coming into the home at least once a week, working so closely with the providers. If you get even a little bit sleepy on a medicine, okay, this is not the one for you, or we're going to back down. We want to keep you just in the land of pain-free, shortness of breath is better. We're not going to let it get too high too fast, because these are medicines that need to be taken very seriously. And so that's kind of how I think about them, is we just start low and we go slow.
And really our mission to make every moment count, means that what matters most to you is happening. You're not asleep, for the days or months or weeks.
Absolutely.
That you have with your loved ones. So,
and I'll have patients too who, worry about, well, I don't want to get addicted,
right.
That's not something that, again, we're not providing these medicines to get anybody addicted to anything. We are just giving you the lowest effective dose to make your symptoms better.
Closely monitored,
And it's not a medicine, once I started, I'm not going to take it away. You're not going to, if you're worried about like a withdrawal, we're just here to make you comfortable. And the other thing too is, if this is a medicine you do not want and you're scared of it, that's okay. We don't have to use it.
We have other things.
We have other things that we can use. And if this is something that you're like, we just want you to know that it's an option. So
something beautiful about hospice that we talk about is the whole person. How do we take care of the whole person?
So, on hospice, we know that people are not only physical beings, that have pain or, have symptoms, but they also are spiritual beings and emotional beings and social beings. And my pills are not going to treat someone's anxiety about what's going to happen to my granddaughter who I'm the caregiver for when I pass away.
Right.
My creams are not going to help someone who is scared because they don't know what's going to happen to them, where they go after they die.
Right.
And those are things I can't answer, as a physician. And so we have social workers and chaplains and therapy dogs. And, we have a whole host of different things as part of our team that we work with every single day to make sure that if someone is suffering, if they have spiritual suffering, if they have social suffering, that we're addressing those pieces. Chaplains, it's not we're pushing this specific type of religion on you. They're trained in every single type of, they're familiar with all major religions and are there, again, to just support someone who's has an existential fear or they have spiritual suffering. We have other things like we honor veterans or, to support our veterans and families and music therapy. We've got, ladies that come, woman that comes in and plays piano in our inpatient facility, does a lovely job, gets people singing hymns and
love it.
So there's plenty of ways that we support and ensure patients' comfort, but is not all medicine related.
That's making every moment count. Good stuff. Well, tell us about a story. Can you share a patient story related to our discussion? How we approached their symptom management, how we made what matters most happen to them, and really made every moment count for them.
Yeah, we had a patient. I'm just going to call him James. James was a gentleman who didn't really have any advocates in his life, and I, didn't really have close family members or friends, and had kind of been. He had cognitive impairment, intellectual disability, was not able to speak for himself for years and years, pretty much all of his life. And by the time he came on service with us, he was living in a group home. He had been, all of these different antipsychotic medications had been added and added and added. And he'd been on them, just to try to manage behaviors, but really trying to maybe sedate him and kind of icky. And then you end up with side effects. He was tremoring. He was having these constant arm movements. He was falling all the time. The poor group home, they don't have the resources to care and support, someone with that level of need. And so, he was on a mattress, like on the floor, because he would fall out of bed. He was just moving so often. So we get him on service. I immediately call the psychiatrist that had been working with him most closely. I call and speak with a pharmacist, and we come up with a plan he's on so many antipsychotics. I think what we're seeing is side effects from these medications interacting with one another. We came up with a plan to kind of slowly wean him down off of these medicines over time. Our social worker jumped on, the case, and, this group home was not the safest option for him. The best option for him would have been a nursing home, like a skilled nursing facility. So I think they called 50, tons of nursing homes until they found one that was like, oh, absolutely, we could take him on. And so James, gets brought into nursing facility where he is now and is doing so much better. Movements are better. He hasn't had any behaviors or outbursts or anything like that. He's got 24-hour nursing care now. And so anyway, so even though he just where he started and where he is, the addition of hospice really helped this man get to a much better, more comfortable place.
So good. What final message, Dr. Anderson, would you have for families considering hospice, especially around quality of life, like James?
Yeah. So I guess my final message is, I trust us. We have patients, with cancer all the time, patients with COPD all the time, patients with heart failure and dementia all the time. And know that, if we offer or recommend something, we think that it's really going to help. And so, definitely consider it and maybe be willing to try it, but also know that if you're the patient, it's your body, it's your choice. And if you're a family member, if something makes you uncomfortable, then that, we are absolutely going to follow, work within those parameters. But we are symptom management experts on hospice, and all we are focused on and prioritizing is what matters most to you.
This is Better Together, a podcast dedicated to making every moment count. Thank you for listening. Please like us and share on your social media channels. If you have a question or would like to learn more about a specific topic, you can find us at www.ourhospice.org or call 812-314-8083. Until next time, remember, life is short. We are better together, making every single moment count.